It's a non-contact sport, but don't tell that to David Harrison, who recently broke his collarbone snowboarding.
I actually had a couple other friends that had this happen to them earlier, so pretty common injury, I guess, especially with it being as icy as it is right now.
David is electing surgery and will get a metal rod placed in his bone.
Yeah, no brainer for sure. Get a little titanium in me, that's not so bad.
Does it look more painful than it really is?
That looks about right. I kind of feel it move around a little bit.
Goes right on to the bone with 3 or 4 screws on each side of the fracture.
Dr. Terrell Joseph is with Vail Summit Orthopaedics. He says head injuries and ones around the shoulder are even between skiers and snowboarders, but when it comes to the lower body, the two ways to ride produce drastically different injuries.
With snowboarding, it's the wrists, and it is very much in beginners.
Dr. Joseph says a quarter of all wrist fractures seen in emergency rooms in Colorado are from within the first 3 days of snowboarding.
Of wearing wrist guards with learning to snowboard. It is like a small car accident learning to snowboard for the first 3 days.
If you prefer 2 planks to enjoy the snow, Dr. Joseph says leg and knee injuries are most likely.
We do see very commonly a broken tibia or broken leg bone from the top of the boot from that same rotary torque, and if your tibia survives and it doesn't break, then knee injuries. So much more knee injuries from skiing.
An NCAA study says women in non-contact sports are 4 times more likely to get a knee injury. Dr. Joseph says his office sees about the same number.
You fractured the mid portion of the clavicle.
But if you want to stay out of his office, there's only one way to prevent an injury: know your surroundings.
50% of surgical orthopedic injuries that we see, either the patient describes going out of control or someone else was out of control and collided with them.
In Summit County, Jeff Todd, CBS 4 Mountain Newsroom.